Hi, this is Dr. Paul Broman with Broman Chiropractic and Wellness, and today we're going to talk a little bit about finding your right recipe. And when I say that, I mean finding the recipe to help you, maybe if your first goal is to get out of pain, but also to kind of take the next step and help prevent and stay out of pain. And it's really important to talk about this, and we have this conversation with every patient that comes into our clinic, because just as each person is uniquely an individual, your plan and your recipe that's going to A, get you out of pain, but B, to keep you out of pain and prevent, the recipe is going to be different for every person, just as every person's unique. So it's really important that we help to kind of educate you and work together to find that recipe to get the best results. So initially, when we're looking at just trying to get out of pain, most new patients that come to our clinic have an initial complaint and something that's driving their treatment that they're wanting to kind of get under control. When you're looking at that initial goal, we start with, on day one, we're going to do an exam. We're going to take a close look at mechanically what are the involvements. We're going to look at range of motion, movement patterns, muscle tension. We're going to do a thorough history, possibly imaging if it's indicated. But we're really looking for the outliers on what are the underlying things mechanically from a chiropractic standpoint that might be causing these pain symptoms that aren't going away. So once we have properly diagnosed and realized the source of the pain and the discomfort that's keeping you in this red zone, or maybe kind of having you have some of these ins and outs, then we can properly start and work on game planning to get you out of that pain. Now, the initial goal is to restore proper range of motion and reduce inflammation. So once we've diagnosed, we can create a proper treatment program. We're going to look at adjusting, we're going to look at stretching, eventually we're going to look at rehabbing. This first phase is the most work, and I always tell my patients, don't be discouraged. This is kind of like going to the gym when you haven't been in a long time, or maybe have never been. It takes time, it takes repetition. You're retraining the physical aspect of your body to create a physical change. So this first phase usually takes anywhere between 2 and 4 weeks, sometimes a bit longer. And with the consistent adjustments, stretches that are indicated, we're able to improve on that range of motion and reduce your symptoms. Once we've achieved that and we feel like you're kind of out of the woods where your pain levels are mitigated and you're feeling a lot better, then we have the discussion on, okay, we found the right adjustments, the right stretches that have helped to improve and reduce your pain symptoms. Now we need to find the right recipe to take the next step to help prevent and achieve a greater level of health and wellness and maintain that. And that's really, that's the beauty of what we do, is we always want people to stay their best so they can live their life, do what they want to do, and enjoy it. And this next phase, we're looking more at retraining the supportive muscles, as it says right here on this diagram. If we're able to find that right recipe of strength and stability work, you're going to hold your adjustments better, you're going to be less resilient to flare-ups, you're going to tolerate physical activity better. So in this phase, we start to decrease the frequency of your treatments in here, and we work more on what you can do at home with strengthening, stabilizing. Now, it should be noted, obviously, chiropractic care is a very important piece of the puzzle, but it's not the entire recipe. So, if we're seeing some barriers in here where there's things that we need to seek counsel on, whether it's working with a personal trainer, if we need more attention to detail on the strengthening piece, if we want to refer out to an orthopedic or another specialist, we'll do that in this process. There's more than chiropractic involved in finding this recipe, but for the most part, if we're able to initially improve on reducing the severity of the symptoms and we can progress into the second phase, that's really about finding that proper mix of how frequently you need to be adjusted, what are the stretches and exercises that are necessary to help maintain and support. So it's important to realize that you're not in this alone. It's a team effort. We're going to work with you to help find the best recipe that we can help you with to get you from here to here. And when it's outside of our scope, when to refer you, when to bring other people in. But it's really a team effort. And although it feels like a daunting task, it's a fun journey, especially when you find that recipe to achieve this state where you can maintain and live at a higher level of health and wellness. That's really our goal for our patients. Again, this is Dr. Paul Broman with Broman Chiropractic. I hope this was helpful, and thanks for watching.